Some New York State lawmakers want to see single-payer health care take shape in New York. One bill would create a health care system operated by the state of New York, and lawmakers and activists are speaking out about it. There was a hearing in Rochester today, and our Jack Watson was there.
Activist Becca Forsyth says her husband was put in the intensive care unit for 3 weeks after a mosquito bite. She says it put her family in poverty.
And we've come home with a heck of a list of meds. A lot of the meds they have recommended were not covered under our insurance.
She thinks the solution to that is the single-payer health care offered by the New York Health Act.
Luckily, he's still with us today, but the long road that we've had to go through is not something anybody should have to go through.
Today, members of the state Senate and Assembly heard testimony about the bill, which would establish a state single-payer system, health care run by the New York State government. One study estimates the cost at $130 billion. Not everyone at the hearing is a fan.
It comes down to jobs and taxes and its impact on small businesses, the small businesses that I represent, thousands of which are in the Rochester area.
Greg Barilla represents New York State businesses with the National Federation of Independent Business. He says the New York Health Act goes too far.
If you add a payroll tax of the proportions that this bill is calling for, that is going to put businesses out of business.
Now, it's important to note that some still support health care for all, but not the way the New York Health Act would get that done. For now, the bill is still in committee in the state Senate. Live in the newsroom, Jack Watson, News 8.
All right, thank you, Jack. Today's hearing at the University of Rochester was the second in a series of hearings across New York. The first one was earlier this year in Albany.